Hello and welcome back to GP Video Podcast by Nadia. I promised on, was it Monday or Tuesday when I started back on, that I'm going to do it regularly, but again, now I've been so busy and my health is on path of recovery at this stage, not recovered fully. My inflammatory markers, I got bloods done after 7 years. I get my patients to do bloods all the time, but I got my bloods done after 7 years because I was so sick last week. So my inflammatory markers, infection markers are high, meaning that I did have something viral or bacterial, I don't know. But anyways, I'm recovering now. So iron levels are quite low, so I have to work on that as well. But I just wanted to make a quick catch up tonight because apart from all the other health issues that I'm suffering from, one of the other things that I am really struggling with is weight gain. So yes, I was saying that one of the other things that I'm struggling with, because I've put on around 10 to 12 kgs in last few months, which again, when you start putting weight on again, everything increases, because as I said in my previous podcast as well, that because fat cells or adipose tissues, they secrete the inflammatory markers, any kind of infection or inflammation in your body, they will just exacerbate it. They will just be, exacerbating any. So I'll put it in very in simple words. Obesity itself causes inflammation, number one, okay? Then if you get an infection from outside or any other inflammatory condition, obesity is only going to exacerbate the process. So number one, it already makes you prone to get more infectious or more inflammatory, because it is itself causing more inflammation in the body. Number two, when you get sick, then it makes you, the process of recovery becomes even more difficult. Okay, so for obese people, so if, for example, if there is an obese person, obese, by the way, obese means BMI more than 30. Okay, overweight is between 25 to 30, while obese is anything more than 30. Then obese class 1, 2, 3, 4, that just goes on, body mass index that we calculate. So first of all, you're more prone to get sick. Number two, when you get sick, it's harder to recover as compared to the person who has got it but is not obese, like of your same age, gender and everything, same category but not obese. So harder to recover and easier to get sickness. So that's what obesity does, basically. So what I was wanting to summarize in this quick video podcast is the weight loss medications that we have available in Australia at the moment. So there are two oral medications. One is phentermine or Fentanyl or Duromine. The other one is Contrave. If you go and see your GP, you can always ask them about these tablets, if you qualify or not. Cardiovascular system is a bit important there, and if you have like very high blood pressure, which is not very well controlled, or heart condition, these medications might be contraindicated, but please talk to your doctor about it. They are basically appetite suppressants. So these are the two tablets. Then we have got injections. In injections, we have got two types of weekly injections. One is Wegovy, which is the private one, and private form of Ozempic or private form of semaglutide. And the other one is Mounjaro. Mounjaro is a bit better in efficacy, and it actually also covers IBS and other stuff as well, but it's a bit more expensive as well. So two weekly injections and one daily injection, which is Saxenda or liraglutide. So three types of injections. Two weekly, you can choose any one of them, or if you want to go with the daily, which is a bit inconvenient, but if you want to go with it, you can go with it. Now, there are two more medications that have been actually added onto the list of weight loss medications. One is Topamax. So Topamax is one of those medications that we use for prevention of migraine. So according to the new guidelines, Topamax can be used in conjunction with Fentanyl or Duromine or Phentermine for weight loss. I still am not clear as to how do we do it, but because I do have a lot of patients who are on Topomex for prevention of migraine. It does have a lot of conditions to be on Topomex. You usually don't give it to women who want to become pregnant, and there are some other conditions as well. But usually there are so many people who are on Topomex. Is a very good drug for prevention of migraine. So that in combination with Duromine can be used for weight loss. Now, I'm again not sure whether if you're only on Topomex, will that work for weight loss as such, or it has to be combined with phentermine or Duromine or not. I will actually read into it more and will come back. And the other one is Orlistat. Orlistat is another oral medication that I've always heard about. I actually used to think that it's not available in Australia, but now in the new guidelines it says that it is there. Orlistat is basically a lipase inhibitor or something like that, which actually doesn't let your gut absorb the lipids or the cholesterol. So these are the two new things that are there, two new medications that are there on the system, in the guidelines, and I will look more into it and will come back to you guys about their use. But in the meanwhile, whatever is available, which is 2 tablets, Fentadur or Contrave, or one of the 3 injections, please go ahead, and if you are fighting with obesity, just go ahead, consult your GP, get it, start doing it, because only exercise and diet, if you are obese, especially if your BMI is more than 30, will not be sufficient. All these 3 things should be together: medication, exercise, diet. Medication, exercise, diet. And no, side effects are not great. Side effects are there are not many side effects. Side effects of obesity are more than the side effects of anything else. See you next time.